Working length can be determined by electronic apex locators and intraoral radiographs. Other less preferred methods are tactile sensation and paper point method. Working length measurement is a critical step. Flare-ups during RCT is mainly a result of error in working length, and it plays an important role in endodontic outcome. So don't rely on a single method. First take a gross idea with pre-operative radiograph. Then when you put a file inside the canal, feel for the friction, or you can say resistance or sticking of file at apical constriction, that is tactile sensation. Then use your apex locator and confirm it. Sometimes apex locator shows that you are away from apex but you are within 1 mm of apex. This may be because apical constriction is very narrow in that case and file is stuck just before apex. This can happen because of calcification, especially in old age patients. So don't force your file, just take an intraoral radiograph with file placed in canals. Then based on all these findings, conclude your working length. As we all know that most of the canals are curved and during biomechanical preparation, it has tendency to straighten up a bit in spite of various flexible files available. Because of flared preparation in cornal 2/3 and straight line access to the apical third, there are chances of changing working length slightly during the biomechanical preparation. You can say just 0.2 to 0.5 mm. So it is always better to take the working length again after preparing the cornal 2/3 of the canal when you are accessing the apical third for final preparation. Need not to take radiograph at this stage, just confirm by apex locator. Then while finalizing the preparation, when we do apical tuning, what is apical tuning? Apical tuning is sometimes after preparation with rotary files, we are not satisfied with the apical preparation, and hand files are used to smoothen the preparation and clearing of all the debris. Apical tuning is needed in greater taper files where apical end of preparation is quite narrow. You can say as narrow as number 20K file. So it appears insufficient and apical tuning is needed. So while doing apical tuning, carefully examine the apical end of hand file after preparation. You can find it coated with dentinal debris. If its apical end is covered with debris, that means file was within the canal. And when file go beyond the foramen, that part of file will not have any debris. So this watchful observation of file will help you to know that your file is within the canal or going beyond the apical constriction. So don't be casual about working length. It should always be in your mind during the biomechanical preparation that you should not violate the apical foramen to avoid the flare-ups and to get the better outcome of root canal treatment. Thank you.